This is Dr. Vinay Samuel Gaikwad, Director Surgical Oncology at Birla Hospital in Gurgaon. This video is going to be about the advantages of robotic rectal cancer surgery. So there's a lot of hype about robotic surgery in general, but the key point that we want to discuss today is the advantages of treating rectal cancer through robotic surgery as compared to, let's say, laparoscopic surgery or open surgery. So this is a very unique surgery for rectal cancer because there are a lot of points in play that are very important to maintain the patient's quality of life after the surgery. So by and large, for rectal cancer, surgical treatment is a very important part of the overall treatment of rectal cancer. So what we are looking at in rectal cancer is number one, and most importantly, is to maintain safety during the operation. Number two is to ensure that the tumor or cancer is removed completely with all the surrounding lymph nodes with negative margins. Thirdly, also very important is if we can preserve the anal passage. That means we want the patient to be passing motion through the normal anal passage and not through a stoma or ileostomy or colostomy or whatever it might be. Fourthly, we want to maintain a good functional outcome, and by functional outcome I mean a good continence. That means the patient should be able to control the passage of stool and fetus, and also the bladder function. That means the urine control should be adequate, as well as the sexual function should be well preserved. So these things that I just mentioned, the organ preservation, which means preserving the anal passage. Number two, the functional outcomes, which mean the preservation of good continence, both for the passage of stool as well as for the passage of urine. And thirdly, the sexual function, because robotic surgery allows these functional outcomes to be superior because we are able to preserve the nerves which control these mechanisms much better, because we have a magnified view, a better range of movement, and we can reach the hard to reach parts of the pelvis better with robotic surgery. The other advantages like lesser pain, faster recovery, that is generally common to most robotic surgeries. So in a nutshell, what I want to say is robotic surgery for rectal cancer helps completely remove the tumor in a safe manner while preserving better functional outcomes, and we are experiencing better anal passage preservation rates or sphincter preservation rates with robotic surgery, which is a very important difference to be noted. So I hope we understand better the advantages of robotic surgery for rectal cancer through this video.